Yes, and we're back here, of course, in What's Up, Doc, the best trending television show in the whole world.
Yes, and welcome to our second segment. Of course, our guest is Dr. George John, the famous, renowned
sports medicine specialist
surgeon.
and an orthopedic surgeon based in Dubai.
Yes, and during the first segment, our hanging question is the Masutra.
Masutra, he's also a movie producer, Masutra, and also the owner of a football team in India. And an owner of a lot of clinics in Dubai and hospitals named Transform.
We'll talk about that later,
Yes, Masutra. So what's the difference between Masutra and Kama Sutra? Yeah, you are a producer of this. Yeah.
What's the meaning of Masutra first, Dr. John?
No, it's if you look at that carefully,
please, can you please...
I'm hiding, my head is hiding K-A, so it's Kama Sutra.
Oh, right? It's Kama Sutra. Okay.
It's Kama Sutra.
Okay.
Okay, like I say, the passion behind each of us, yeah? If you ask Dr. Jensen, what's your desire? You might say, yes, a plastic surgeon, predominantly.
Yes.
And you have a lot of other interest coming into your life. And I believe each of us has a lot of dreams in your life, in you, right? It may not come every time, but it comes in times when you have an encounter with the right people. For me, like being a doctor for Tom Cruise, every time we should have a dinner together or lunch or a breakfast, he always talks about the movie, and he always said, Doc, you should get into movies. You should get into movies. Then my friend is a classmate. He's a film director by himself.
In India?
In India.
Okay.
After 15 years, I met him. Same thing happens.
So,
Then he told me, remember when you were in the school, you used to act. You love dramas and everything.
Yes,
so I said, yes, it's already in me, this kind of desires. And then I said, my friend and myself, did this movie, Kama Sutra 3D. This is
has been shown already?
It's releasing in January, February. It's coming to the Philippines.
Okay.
Because it's an English movie.
Wow. Okay.
What we try to portray it is the Kama Sutra, as you know, is a brand of love.
Yeah.
It started off in India ages. I mean, we are talking about 100 years ago.
100 years old.
So the movie was very expensive to us because we have to build in a fresh, big, massive ships made of wooden.
Really?
Stocks. Yeah. So it costs a lot to us. But the beauty of that is the passion in love.
But do you have any plan of being an actor or any dream role? If you would be an actor
given a chance
in the future, given a chance.
I think why not?
Yeah. Okay.
What genre? What genre?
See, now, as I said, now I'm into medical thing, into sports thing.
Yes.
So my next dream would be to make a movie on Surgeon's Grave.
Surgeon's Grave. Wow. Are we included there?
Yes.
Like the movie?
I'll be the stuntman.
Because it's as you understand, surgeon's life is something different. People call us tough, rough guys because we take decisions. We deal with the human beings. We deal with the bodies. We do surgeries. Which is a lot of reconstruction involved.
Yes.
So a lot of crave in us. Many people cannot understand the other side of a surgeon. So my movie, next one, if possible, would be to portray all this, the tough side and rough side of surgeon, and the soft romance side of a surgeon.
That would be a great movie. A lot of doctors, spouses, girlfriends of doctors will.
They thought that doctors' life is just like that, and they didn't know the agony and the stress of being a doctor, especially during nighttime, after having all those procedures and surgeries that have been done in the office or in the hospital. And of course, we're thinking about do we do the right thing or
the many things, like you see, I'm sure many of you watches Grey's Anatomy.
Yes.
And it's kind of a medical thing, stuff going on. You're interested. A lot of people are watching this one. So
and we could also inspire some future, kids who wants to become a doctor, and they will be inspired to go ahead with the dream. Yes. And let's say, okay, if you be an actor, and what would be your dream role? and maybe you're possible leading lady.
Yeah. Wow. Dream role first. Dream role.
Yeah. Dream role. I mean, I should be the surgeon of the movie.
Okay. The director, the producer, the actor.
Yeah.
I mean, if possible. If possible. And then I say, on my right side, maybe Nicole Kidman.
Wow.
On my left side, maybe Jennifer Lawrence. I would be happy.
Yeah. Is this really being a film producer? Is this a dream during your childhood years, or it's just come out by accident?
You know, I mean, one of my uncles is a film producer.
Your uncle was a film producer.
But I sort of hated all of his movies because it's not inspiring me in any ways. You know, he too used to take classic movies and everything, but he used to talk a lot about the movies.
Okay.
And I said, yeah, if I would do it, I would do in a different way. So always there is something in me to, you know, see, it's a creative. You know, it's surgeons are reconstructive, creative guys.
Right.
So our mind is something. You know, why can't I do like this? Why can't I do something, venture into something new?
Yeah, because, you know, medicine is an art.
It's an art.
Yeah.
So I appreciate beauty, so I appreciate action, I appreciate the talent, so why not get into something if you have time.
And Tom Cruise, you have to
I mean,
you have to cast Tom Cruise along you.
I take care of, you know, the Bollywood actors. Mainly.
Bollywood actors.
Yeah,
okay.
I encounter a lot of actors in my life, as patients, as friends. Then I said, I love to do this because it's a business side is good because if you have the right script, right writers, and you know photography and direction, your movie can be a successful.
And you're fulfilling one of your surgeon's crave, which is acting and producing.
Okay.
Yeah.
Wow,
now being an actor or a producer, and now you also own a football team
in India.
In India.
Yeah.
I mean, here in the Philippines, if you own like a team, you know, you're big time, and you really must be really doing good.
One of the most powerful,
very influential.
Yes, very influential, powerful. If you have a football team here in the Philippines.
Yeah.
I mean,
how did you engage in that? I know you like football, but being a football
because
owner of a
as I
football
said,
team is different.
in Africa, I went to Africa 4 years ago, and the incident starts with me like. When I finished surgeries, I saw a tall man waiting outside for 3-4 hours for me.
Okay.
And by look of him, I thought, yes, he should be a basketball player.
Yeah.
And he came to me and said, Dr. John, I have a knee problem. And most of the seen by a lot of surgeons and did 1 or 2 surgery, but not fixing the problem. Okay. So he's a captain of the Kenyan national team.
Kenyan national team.
And he get into a game, then he withdraw after 3 weeks because of the problem.
Yeah.
So he said, I was in the news, like I was in the TV show in Kenya, and I was in the news. So the next day he came to me and said, can you fix my knee?
Okay.
Then it was a difficult case, but we fixed it, and he's playing for the national team. So, you know, my liking towards the club and started off or got inflamed more and more by seeing these incidents in my life. So India never had a football of their own. They love cricket and nothing but cricket.
Yes.
So last year I got an opportunity to be a co-owner of. We have only 8 teams in India.
Oh.
Only 8 teams in India. So one of the film actor and myself joined together.
Wow.
They are very lucky, the team that you have, because you're the owner, but the owner is the surgeon of the players.
I mean, it adds to the value of my players. You know, they're confident to be in the team, and they know that if they get injured, we are the
if I have injury, no problem.
No
I
problem.
have the owner, Dr. John.
Dr. John is here. She's gonna take care of everything.
Difficult for me sometimes, but you know, I want to relax with them. But
is it free? That's free, right? If your players got injured,
of course,
because you're the owner.
I cannot charge.
Do you make personally? I mean, if you can answer this, do you make good money as a owner of a football team in India?
Yes. Put it this way: last year, the value of the team is 100 million.
Okay.
100 million.
After 1A is 235 million.
Oh, brother, can you give me for my team?
I can play football.
So it's not bad, huh?
Yeah.
It's not a bad money. So, but the thing is, any sports you say, you know, my advice to some of the people is that sports never die.
Okay, right. That's true.
You put it anywhere in the world. You do anything connected with sports in the right thing, the right way, it will be a success.
Okay.
Yes,
Either you be a doctor, either you be the guy who makes the shoes. You can see Adidas, Nike, everything.
That's true. You get a lot of endorsements.
Or clubs. You see the Real Madrid again is the richest club in the world.
Real Madrid. Yes.
So you see a lot of things in sports.
Next
it's like beauty. You know.
That's true.
Anything you touch in beauty is not going to fail.
Yes. You know, Dr. Lau, Dr. George Jan has also another business, which is we call it Transform.
Yes, here is a pamphlet.
Yeah, this is the pamphlet of Transform.
It's very intriguing.
Yes, can you tell us about Transform in Dubai?
Yeah, I mean, as I said, we have 3 brands. One is the GJ Sports.
GJ Sports.
Look after the buying clubs and running the league in Africa. We do GJ Sports Medicine Centers. That's again a GJ brand.
Okay.
We have Otus. Otus is something that the hospitals.
Yes.
We have hospitals under the name of Otus. And Transform is our new brand, which is we are transforming people in a way. Not in a big way, but whatever little contribution we are giving to the patients, giving to people, they come and tell me, oh, thank you, Dr. John, you transformed my life.
So when you
just keep telling me,
the words speak for itself.
Yes.
It's just like changing a life of a person.
Yep.
Okay. What are the services involved in Transform?
I mean, it's a center. Transform is a center where a group of doctors come in, group of physiotherapists, sports therapists, massage people, then conditioning, strength coach, fitness training.
So it is a holistic
approach. You know, mental fitness, nutrition. Then you have diagnostic centers, the various modalities, how to know you're fit.
Yes.
What is your performance level? We can assess all that. And I'm very glad to tell you is that Transform in Dubai is rated as the top 3 in the world.
Wow! So it's a branded name.
The brand is a top 3 in the world. It came in the news in Africa, in Europe, in our local media. Is a top 3.
So are you planning to globalize Transform?
Yes, we are going to go to 62 countries.
62 countries. Wow!
The next one would be in Philippines, hopefully.
Hopefully, yes.
You're a very busy person, Dr. Jan.
And Johnson will be also transformed.
Yes, I mean, my thing to here is that the new concept, if you ask me, in the modern one is the beauty and sport.
There you go.
Beauty and sports.
That's the concept we are bringing in. After I met Dr. Jensen, that's striking me quite confidently, saying that this is the way to go.
There you go.
So he's a transformer. He's a reconstruction, and he's giving life to people. Same thing we do in sports or in normal people who cannot walk. We put a new knee joint, he can walk. It's a new life. So we strongly believe in the transforming people. So that's why we are going to knowledge.
Sports and beauty, the new trend.
The new trend.
Yes.
SNB.
Abangan niya yan.
SNB. It's like sports and beauty. Okay,
So,
you know, alam mo, Dr.
One of the most common
is
problems
osteoporosis.
in
Yeah, for
Since
aging
our
patients.
guest is an orthopedic surgeon, let's
Yes.
talk about osteoporosis.
Osteoporosis.
Common problem here in the Philippines.
Yes. What is osteoporosis?
I mean, osteoporosis is a universal disease.
Universal
It's
disease.
not only in Philippines.
Okay.
People are struggling. Billions of dollars has been spent for osteoporosis.
Research.
There you
If you have a national health care in the
that's
US and UK. It's a big problem.
Yes.
And mainly involves with the women because of the
Hormonal.
menopausal changes.
Yeah. Yes.
Estrogen comes down, your bone get deficit of the good cells. The good cells is called the osteoblasts. The bad cell is called osteoclasts.
Yes.
So 10 cells coming into your body, in your bone, 5 goes out. That's a good phenomenon. Just imagine 5 comes in and 10 of the good cells goes out of your bone. Your bone become weak and weak.
That's not
and
a good
big
number.
gap
Yes.
There's a gap, yeah.
So sometimes if you trip, little bit of you trip, you can have a fracture. And this fracture, however good you fix it, it's difficult to heal it. It takes a long time. That means the patient is going to be bedridden for some time.
Right.
And other problems comes in, like the cardiac problems, kidney problems, everything will.
So osteoporosis.
So this is very, very important issue it needs to be tackled in the right way at the beginning stage.
That's true.
We don't have to wait for the fracture to occur.
Yes.
We need to prevent this problem if possible.
Yes. Talking about prevention, Dr. John, what is your advice for the prevention?
For patients to prevent
one thing I believe is life is motion. That means you need to move every day. If you can take steps and steps every day, that can boost your bone a lot.
Yes.
So never ever be lazy in a day, even in a day, not to exercise. You need to exercise. You need to be active in your life.
Because you know that our body is really designed for movements.
Yes, absolutely.
Yes.
Walking is a good exercise. If you cannot run, if you cannot do anything, just at least walking is good. It gives something called axial loading on the bone, and it can regenerate by itself naturally.
Oh. Okay. So this is a regenerative, a generative disease, degenerative disease. I mean. And there is one that we mentioned before. We call it MBST. Is
yes,
like nuclear magnetic
resonance therapy.
Yes.
Can you tell us about that? MBST.
I mean, I've done a lot of studies on cartilage. I've been a speaker in Japan, in Dublin, in England. I go a lot of countries to speak about cartilage problem. As I mentioned to you before, cartilage problem is one of the problems we cannot really tackle. And we need to exercise and prevent that problems quite a lot. And one day I finished my clinic, and so my always in my mind, like I said, you know, how you can regenerate your body.
Yes.
Yes, we can do it as a surgeon, and we have done it.
Right.
But not in many cases. Sometimes we don't expect the results we wanted in a patient after surgery.
Yes.
So we tend to say that what is the alternative?
But you know, just for a short comment, cartilage is also used by the cosmetic surgeons, or sometimes we do it in augmentation to get it from the ear, and then we put it on the bridge.
Absolutely. We do the same. We sometimes the cartilage is deficit, we take it from the normal side and put it inside. In the knee also we do that. In the shoulder we do that. So what happens, once I finished my clinic in Dubai, I went out and I saw a lot of Germans sitting in my clinic. And they said, we want to meet you, and they invite you to Germany to meet the professor who invented MBST machine.
The MBST.
Okay.
The inventor
so this is the German technology.
This is the German technology.
Okay.
The inventor of this is not a doctor, or just...
He's a medical scientist, medical engineer kind of thing. He's not a doctor.
Yes. Okay.
So what is the process? I see here in the brochure, a patient lies down in a machine.
Absolutely.
What does the machine do?
Okay. Now, your body is 95% of your body is water.
Yes.
You know that.
Yes.
And it's a proton. It's like a positive, negative field. And you are alive, and your cells regenerate because there's a center of gravity of the earth always on you.
That's true.
So you walk, you do things, your cells started moving because there's a positive and negative field. And earth creates a field, magnetic field in your body, always. This machine, what it does is that it allows if the cell is dying, it should be thin and it doesn't move much. That means it's dying.
Right.
If a cell is that size and it keep moving, that means the cell is alive. So if the cell is likely to die, these machines will create a field in which it can spin the cells. The more it spins, it absorbs energy and it regenerates.
Okay. So it activates the cells.
Absolutely.
Yes.
How many treatments, Dr. John? For example, if a patient has osteoporosis, how many treatments?
This is very important because you need to do 9 days. You cannot miss a day.
Continuous 9 straight days.
1 hour.
Okay.
1 hour a day.
That's it?
Can you feel anything during the procedure?
You will not feel it. It's not painful. It's not injection. It's not surgery.
You just lie on bed.
Lie down like you do it
for
in
an hour.
Scan.
For an hour. Yes, you just lie down for an hour.
1 hour.
What you call the MBST, where you just lie down on
for just 1 hour
and
for
every day for 9 days.
Is this an invasive one, or
no? Not at all.
It's a magnetic resonance.
Yeah.
Okay. It's just like
as you know, X-rays are, MRI scans are safer than X-rays.
Right.
And this is 100 times safer than MRI scan.
So 100 times safer.
You're not talking about any radiation. You're not talking about any harmful field in this machine.
So is this machine still confined in Dubai only, or in other parts of the country?
Okay, now after meeting the scientist, and the background of the scientist is that he's not a commercial guy. He doesn't want to make money out of it, but he wants the clinical side to be improved. and he wanted to see the effect of the machine on patients. So we signed an agreement then and there to take this machine outside Germany. So I'm the one
official
to promote
distributor
of this one.
Hopefully this machine will come here in the Philippines to help a lot of aging patients here.
That's a plan.
That's the concept.
That's the bigger of beauty and sport coming together
with MBST.
Yes.
Wow.
End of the day, it's to regenerate your body.
Yes.
So
yes. MBST is specifically for osteoporosis only, or it does
any other diseases?
Yeah, it's for three things. One of the thing is that in Germany they started doing this treatment for some of the middle-aged ladies.
Okay.
And after 3 months, the husband said, "What happened to your face? Your face started glowing."
Oh, okay. It's also for rejuvenation.
Yes.
Okay.
And they don't connect these two together. And a lot of girls started telling, or the boyfriend started telling, or husband started telling them, "You changed your face. You're looking more beautiful. What happened?
What are you doing?"
Then everything comes back to the scientist. And then he started thinking, yes, it's a field you create. It's a field you create, and you see the rejuvenation happening in your skin. And now the professor started a separate link on beauty.
It's like a regenerative medicine.
Yes.
You regenerate the tissue.
Yes.
You stimulate the cells to live again, and it can only also be applied in cartilage, soft
bones,
tissue,
and soft tissue.
Wow.
So you mentioned the first one is for skin rejuvenation, for osteoporosis. What's the other
cartilage.
one? Cartilage.
And tendons, sometimes you have tendonitis.
Yes.
Tennis elbow. It's good for that.
Oh.
Yes. Dr. Georgian, your practice is incredible, and I know I've been to his clinic and in Dubai, and I've seen his practice, and I could say that's a very successful, not only successful, very popular
very
doctor
successful
in Dubai.
doctor,
Remember the
producer.
name, Dr. Georgian.
Yes.
Transform.
And we are very happy and honored to have Dr. Georgian to be here in our WhatsApp.
I just want to ask one question for you, Dr. Georgian. Do you have any vision of sports medicine here in the Philippines and also the whole Asia? Any vision?
Yes, definitely. Because that's one of the reasons I'm here. Because in Philippines, when I look, there are a lot of beauty queens and there are a lot of sports stars.
Right.
Like you said, you have a basketball team, you're a football team.
Yeah.
Last year I was
and also boxing.
Boxing, of
boxing,
course.
like
Yeah. And last year I came here. I was one of the brand ambassadors for a tennis tournament here in Philippines to promote the charity work. So I played for that tournament. So I say that it's an emerging economy, and I was listening to one of your leaders speaking in the TV 2 days ago. The GDP has gone up to 6.85, which is very interesting.
Yes.
Because it's the fastest growing country in the Asia.
That's true.
And if possible, if everything goes well, I want to make Philippines as the hub of our center
in the whole Asia.
Philippines is very lucky.
Well, thank you very much,
Dr.
John.
Chooses the Philippines.
Yes. Wow, Dr. Lau, talaga we're running out of time. Kaya lang talaga, we still a
we've
lot of things to discuss.
But marami pa tayong pwedeng pag-usapan.
I know.
Hopefully, Dr. Georgian will come back here in the Philippines.
He can be a mentor for everybody.
Yes.
And Dr. Georgian, thank you very much. And any message? You have a tournament or invitation?
Any plug? You can plug.
On December, right? Can you tell us about that? The tennis tournament?
Yes, in fact, today I got the official note from the International Premier Tennis League that I'm be the medical doctor for the tournament. And December we'll be in Manila with the famous top players of football. Tennis. Like Roger Federer.
Roger Federer will be coming here.
Sharapova. Everybody will be coming again. So we'll see you again on that day. December. 3 days.
We can give us our guests in our show.
All of the athletes here in WhatsApp Doc.
Trending again.
Yes.
Wow. Thank you very much, Dr.
Thank you very much, Dr. Georgian.
We're really very honored to be our guest
I'm
on our
really,
TV show.
humble and honored to be here. And like a big brand, Dr. Jensen, I heard lots about him and excellent work he's doing. And if we can contribute something together, and that's going to be one of the
coming soon. Coming soon. Sports and beauty. Coming soon.
Where can you find you, Dr. Lau?
Yes, you can see me in all branches of Janssen Cosmetic Surgery in Manila, Quezon City, in Angeles, and in RL Medical Clinic in Retiro, Quezon City.
Yes, and you can log on at www.jansencosmeticsurgery.com, and we have a Facebook and Instagram account, and that's Janssen Cosmetic Surgery. And of course, this will be aired tomorrow, again, on Sunday.
1 o'clock to 2 p.m.
Yes, at Channel 1 on G Satellite, Channel 8 on Destiny Cable, and Channel 213 on Sky Cable. And of course, again, thank you very much, Dr. Georgian. Thank you very much to O'Hara, who brought us Dr. John here in the Philippines. And thank you very much to all the staff and crew of Global News
Yes,
Network.
belated happy birthday kay Jigs nga pala.
And of course, you can find us at Manila, Quezon City, and Angeles City. And again, this is Dr. John Seneca for another episode of What's Up, Doc?
Thank you, Doc.
There's a tear in your eyes, I know. I can feel that it's not been dried out all these years.